My name's Courtney. I'm one of the PA students that'll be doing your neuro exam today and your musculoskeletal exam. So first I'll begin just by washing my hands. Okay, and I'll start by doing just a general survey, assessing his mental status. So I can see that he's not in any current respiratory or acute distress. He's sitting here calmly in no pain, no anxiety, correct? No pain?
Correct.
Okay. I can ask him what his name is for orientation, his birthday.
September 23rd,
And
2000.
Do you know where you are right now?
Yes, I'm in the office.
Okay, so he knows where he is right now. So that's alert and oriented ×3. Okay, and then we can begin by assessing his memory, both recent and remote. So I can ask him what the weather was like yesterday.
It was cloudy.
It was cloudy. And then for remote memory, I can ask you, do you know who the first president was?
George Washington.
Okay, correct. Okay, so then we can also assess his attention and his concentration. So I'll give you 3 words, and then we'll come back to them in about 5 minutes, and I'll have you repeat them back to me. Okay? So chair, ball, and wind.
Chair, ball, wind.
Chair, ball, wind. Okay, so remember those, and we'll assess your concentration as well. So can you spell the word world backwards for me?
Yes. D L R O W.
Okay, so that was correct. We can move on to the olfactory testing. So I would have a scent that's familiar, maybe cinnamon or mint or lemon. I don't have one right now, but I'll have him occlude his right nostril, okay? And then I would put the scent under his nose, have you take a deep breath in and smell it, okay? And the same, occlude your left nostril, place the scent under his nose, take a deep breath in and out. And before that, of course, checking for patency so that I know he can actually smell the scent. And we can move on now to the optic nerve. So I can test his visual acuity. I have my Snellen chart right here, okay? So I'll go about 6 feet away from him. All right. And I'll have you close your right eye. And read for me the lowest, clearest line.
D H C E F.
Okay. And cover your left eye.
D H C E F.
Okay. So that was our visual acuity. So I'll continue the exam doing the visual fields. Okay, so I'll stand in front of the patient, have him cover his right eye, and I'll cover my the same eye opposite him. Okay, and so I'll begin with testing the upper right quadrant. So I should be able to see my finger come into my visual field at the same time that he can, barring that I have normal visual fields. Okay, so let me know when you see my finger.
No.
Let me know when you see my finger.
No.
Let me know when you see my finger.
No.
Let me know when you see my finger.
No.
And let me know when you see my finger.
No.
Okay. And we'll switch to the other eye and repeat the exam. Let me know when you see my finger.
No.
Let me know when you see my fingers.
No.
Let me know when you see my fingers.
No.
And let me know when you see my fingers. Okay. So I'll continue the exam by mentioning the need for a fundoscopic exam at this moment, okay? And I'll also ask him to repeat back those 3 words from earlier in the exam. So if you could do that.
Ball, chair, wind.
Okay, so he was able to remember those. And now we can move on to assessing the oculomotor, trochlear, and abducens cranial nerves. So I'll have the patient follow my finger to assess for extraocular movements. Okay, so that'll be the big H movement. So look at my finger and just follow it. Okay, he was able to follow it. I didn't note any fasciculation, so any like tremors in his eyes when he was following my finger. Looking at him, I don't note any ptosis. I don't note any lid lag. I don't know any nystagmus, again, as I was doing the extraocular movements. I can see that his eyes are symmetrical when he's looking at me, okay? And I can check his pupillary reactivity with my pen light. So checking for the right eye. Constricts as I shine the light in it. And it constricts a little bit as I shine the light in the right eye as well. I can then move on to assessing the trigeminal cranial nerve. So I'll palpate the patient's TMJ and check for sensory in the three locations of the dermatomes on his face. So I'm gonna have you clench your jaw for me. Okay, and I can feel his muscles moving as he clenches his jaw. And then I'll check for in the three branches for sensory, and I'll use one of my pencils here to check for dull and sharp sensations. So just give me your hand. So this is going to be sharp, and this is going to be dull. Okay. So I'll begin by checking the left side of his face. So tell me whether you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
And now the right side.
Sharp. Dull. Dull. Dull.
You hurting you?
No.
Okay.
I thought it was over. Sharp. Sharp.
Okay. So that was on both sides in the three branches. He was able to differentiate the feeling of both of the sensations, okay? So we continue the exam with the facial muscular nerve exam. So I'm going to have him smile really big, okay? Show your teeth, and then puff out your cheeks for me. Squeeze your eyes tight, really tight closed, okay? Raise your eyebrows for me, okay? All right, so he's able to move all of the muscles in his face, okay? I can continue to the cranial nerve 8, which will test for any acoustic problems. So when I hear him talking throughout his assessment, I didn't note any hoarseness coming from him. So I can also check for bilateral raising of the uvula in his throat when I do a gag test as well. So I can just verbalize that I would do the gag test, and I can also look in his mouth to see his uvula, okay? Stick your tongue out. Ah. Okay. So when he says ah, his uvula goes up symmetrically, okay? And I can then perform these. So I can now check for any acoustic problems, checking cranial nerve 8, okay? And I can do that by performing the whisper test, and I'll also mention the need for the Reiner-Weber test if there was any abnormality with the whisper test, okay? So cover your left ear for me, just push right into your ear.
Yep.
What did I say?
Peanut butter.
Okay. I'm gonna give you a different word.
Okay. Allison.
Okay. So he was able to hear both of those words, so I won't continue with the Reiner-Weber exam, and I can then continue testing the glossopharyngeal nerve and the vagus nerve. So I can do that by checking his uvula and his tongue, and also throughout the exam I've been listening to his voice, and I haven't heard any hoarseness, so I can note that he's not having any trouble getting his words out in terms of the tone. Okay, so I'll look in his mouth just to see his uvula. Say ah for me. Okay, I can see that it rises symmetrically. Now have you stick your tongue out all the way. Okay, and I can see that there's no deviation with his tongue. It sticks out symmetrically. Okay. And that was the hypoglossal nerve, was the tongue, okay? I also didn't note any fasciculations with the tongue when he sticked it out. It wasn't twitching, and I didn't note any asymmetry with it. So I could also perform a gag reflex test. I'll just mention the need for that though, and when I do that, I'm looking for bilateral rise in the palate, okay? And for the final nerve, I'll test cranial nerve 11, all right, the spinal accessory. So I'll have the patient shrug his shoulders against my hands. Okay. Shrug up. Okay, so he's able to shrug up while I'm pushing down. And I'll track his sternocleidomastoid muscle using my hand on the side of his face, and I'll have him turn into my hand against the resistance. So try and turn your head there, and I can see the sternocleidomastoid muscle protruding, and I'll do the same here, and I can see it there as well. So now we can move on to any inspection of the exam. So I'll note any muscle tone on the patient, any places of atrophy, or places of muscle abnormality, basically, decreased or increased. And I can perform the Romberg and the pronator drift test, so I'll have the patient stand up. Okay. And I'm just gonna, spot him just in case he falls. Just close your eyes for me. All right. Put your feet together. All right, and I'm just looking to see if the patient starts to sway. I'll have him hold it for about 30 seconds. Okay. All right, so no swaying noted. You could open your eyes for me. And then I'll perform the pronator drift test. So I'll have the patient stick out his arms like this for me. And I'm noting to see if his arms start to turn inward, okay? So there's no drift noted, okay? I can also check for rapid movement, so you can sit back down for me. And then on top of your thighs, I want you to alternate turning them up and down your hands. Okay, so he's able to rapidly turn his arms. And I'll now assess for cerebellar function, so we'll do the finger to the nose test as well as the shin sliding test. So I'm gonna have you touch your nose and then touch my finger, okay, as I move it around.
Okay.
So nose, finger, nose, finger. You don't have to go fast.
Oh, okay.
Nose, finger, finger, nose, finger, nose, finger,
No way
nose,
is going exactly.
finger. Okay. So then we can perform the heel to shin test. So I'll have you take your right leg and slide it from your toe all the way up your shin.
Okay.
There you go. And back down. And back down. And do the same thing with your right leg. Okay, so I can note that he's able to do that as well as he was able to do the nose to finger test. Okay. We can continue with his gait. So I'm just gonna push your shoes out of the way here. I'm gonna have you stand up. It's okay. I'm gonna have you walk like you're on a tightrope, okay? Just heel, toe,
Okay.
heel, toe, all right? I'm just observing his balance and that he has proper walking technique from heel to toe. Okay. I'll then have the patient walk just on his heels, okay? Supporting him, make sure he doesn't fall, and you can come back around. Okay. Now I'll have you walk just on your tippy toes, okay? Turn around and come back. Okay, so he's able to do both of those. There's no foot drop noted because he's able to walk on his heels, okay? So I can then, you can come sit back down for me. I can check for spatial awareness. So I'll also note that we checked the patient's proprioception while doing the finger to nose test, as well as the Reinberg test when he was able to stand. And he was aware of his surroundings, being able to stand still, and he was aware of his nose and where my finger was, able to complete that test as well. So I can continue with checking his reflexes. I'll begin by checking the patient's, if you don't mind just taking off your jacket. I'll check the the biceps one first, we'll check. So I'll just have you bend your arm and relax it on your hand there, on your leg. I'm gonna feel for the patient's brachial tendon. And thank you. And I'm gonna press down with my finger. And I'm gonna tap my finger with the pointed end of the hammer here, okay? So you can relax your arm now. Okay, so I was able to note his finger twitch there. So that's the brachial reflex on his right arm. You might point up your sleeve, and I'll do it on the left arm as well. Locating the tendon, pressing down on it, and relax your arm. And I was able to note his finger twitching there as well. So I can move on to the triceps tendon. So I'll stand behind him. I'm gonna hold his arm up, and right above his elbow here, I'm going to use the flat side of the hammer. I'm going to note for his reflex. Okay? So the reflex is noted on the tricep in the right arm, and I can do the left arm as well. Okay, so it's noted in the left arm on the triceps too. And then we can do the brachioradialis. So I'll have you just relax your hand down for me. And I'm aiming for radial nerve right up about here. Okay, so I can note that there's a little jostling with his thumb, but I see his index finger flicking out, okay, when I hit it. So I'll do it on the left arm as well. Okay, so I note the finger twitching out on the left arm too. And I can move on to the patellar reflex. So sitting as he is fine. I'm going to go right below the patella. And again, using the flat side. Okay, and his leg kicks out, so that's the left side. Rather the right side, and this is the left side. Okay, and his leg kicks out. So I'll continue testing the reflexes by testing her Achilles tendon on both sides. So I'm just going to strike right against her Achilles. It's the right side and now on the left. Okay, and the left side. So I can now perform the Babinski reflex. So in a healthy adult, his toes should curl in. Meanwhile, in infants, you'll see the toes fan out. Okay, so I'll take the opposite side of my hammer. I'm gonna make a C formation on his foot. And there you go, the toes curled in, so his Babinski reflex is negative. You can put your sock back on and sit up. I'll also note that when he was walking, I was looking at his posture and his arms swinging in regular motion as he was walking, which he was able to do as well. So I'll also be doing the musculoskeletal exam today, so I will note that I'll be doing that portion of the nervous system exam in with the musculoskeletal exam, where I'll assess muscle tone, assign grading to each of his muscles, checking for movement in all planes and grip strength as well. Okay. So I can check for dermatome sensation now in all of his extremities. So I'll alternate between sharp and dull touch as well as light touch and vibration in his fingers using one of my tuning forks, okay? So again, just to remind you what sharp felt like and dull, okay? So just let me know what you feel.
Sharp, 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 dull, 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 sharp, dull.
And then the right, left arm.
Sharp, 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 dull, 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 sharp, dull.
And I would do it on his legs as well. Just do it on your lower leg.
Sharp, sharp,
Don't cheat.
dull, dull, dull,
Okay, and the left leg.
sharp, dull, dull, sharp.
Okay. So he's able to note the different skin modes as well. And I can check the sensation for light touch, so I can just gently touch over his arm. Let me know. Okay.
Mm-hmm.
And let me know here.
Yeah.
So you can assess light touch as well. And I'll grab one of my tuning forks to assess for vibration. So I'll assess this over the DIP joint of one of his fingers on both sides. So your middle finger, whichever one you want. Sorry. There you go. Do you feel the vibration?
Mm-hmm.
I'm gonna do the same thing on his left hand.
Yeah.
Vibration? Okay. Okay. I'll do the same thing on his foot.
Yep.
And the DIP joint of his big toe as well.
Yep.
Okay. So he's able to feel the vibration. Now I can perform the Brzezinski's and Koenig sign tests, which if he does not have meningitis, they will be negative. So I'll just have you lay down for me. Okay. And for the Koenig's test, I will lift his leg, and his hamstring, if he had meningitis, will be extra stiff and he won't be able to lift his leg all the way up. His knee will start to buckle. Okay, so he's able to lift his leg up without the knee buckling too much. And then for the other test, the Brzezinski's, when I lift his head, if he has meningitis, his knees will pull up as well. Okay. So, negative sign as well. And that's the neuromuscular exam. So I can test for stereognosis, which would be her being able to tell me what I am giving her in her hand with her eyes closed. So just close your eyes for me and hold your hands out and tell me what this object is.
A pencil?
Okay, so she was able to tell me what the object was. I'll now be performing point localization. So I'll be touching the patient's finger because it's most sensitive. And I'll use 2 different points, and she should be able to feel them as 2 points up until they're at a certain distance apart, and then it'll feel like 1 point. Okay, so just hold out your hand for me and close your eyes and tell me when you no longer feel 2 points.
2, 2, 2, 2, 2, 2, 2, 1.
So at about a centimeter, she wasn't able to feel the differentiation anymore. So I'll begin the musculoskeletal exam by observing the patient's gait. So I'm going to have her walk tandem. So she'll walk like she's on a tightrope, going heel to toe. Okay? Okay. You can see that her posture is good when she's walking. She's able to walk in a straight line, and there's no excessive swinging of her arms. I'll have you come back to our starting point. And then walk on your heels for me, like a penguin. There you go. Okay. And again, she was able to walk straight, not falling over. And now we'll have you walk on your tippy toes. And I'll spot you. And she's able to walk straight. She's not flailing or falling over. And you can have a seat for me. Okay. All right. I was able to also note while she was walking tandem that she was striking the floor with her heel and then following fully through until it reached her toes and pushing off as she walked. So I can now assess the muscle tone on the patient just by inspecting. So I can see that there aren't any obvious signs of atrophy. Okay, there's no signs of excessive muscle, decreased muscle atrophy, or any shoulder elevation or lag. And I'll just have the patient stand up for me a second. I can also note that her hips aren't tilted. There's no pelvic rotation there. Okay, sit back down. I can look at her extremities, so I'll note her arms. Just by looking at them, I don't see any gross deformities. I don't see any atrophy. All of her limbs are there. And same with her legs, no gross deformity of the legs and no atrophy as well. So I can move on by saying that there also doesn't note to be any erythemia when I look. There's no redness. There's no edema, no abnormal swelling. Okay? That's okay. Okay. I inspected the hips. There was no abnormal rotation or pelvic tilt. Okay. The knees, there's no deformity of her knees. There were no scars noted on them. So I don't see any signs of joint replacements. There's also no erythemia, edema, or deformity to her ankles, her feet, her legs, or any of her extremities. So I can move on by inspecting the spine. So I'm just gonna go right behind her. Okay, and I'll palpate the vertebral spine, checking for any step off. Okay, so first I'm able to look at her sitting up straight. I don't note any signs of obvious scoliosis or kyphosis. So I'll begin at the cervical spine, and just to warn the patient, I'm going to be palpating on your spine from your neck all the way down to your tailbone. For the sake of the video, I'll stop at right above the sacral vertebral. Okay, so I'm palpating, making sure there's no pain, so let me know if you feel any pain. And I'm also palpating for any step off to see if her vertebrae are misaligned, and if I feel any crepitus as well, which would be like a crackling sound. Okay, so no pain? No. Okay, so there was no pain noted, okay? And I can also palpate her extremities, so we'll come around here. I'm just noting for any areas of pain as I touch them, any areas of swelling, especially over joints, looking for any edema versus effusion. Okay, so I'll begin at the shoulder. Let me know if there's any pain. No. And there's no warmth noted either. Pain.
No.
Pain.
No.
Pain.
No pain.
Pain. Pain.
No.
Pain.
No pain.
And no pain. Okay. So her extremities, there was no pain, there was no warmth noted, and there was no crepitus when I was touching them, so I don't feel any fluid underneath them. Okay. I can move on to palpating the vertebral spine. So I'm just going to, well, I already palpated it, but I'm going to percuss it. So I'll use my fist and I'm just going to knock down her spine kind of. And if she had any metastases, it would be quite uncomfortable for her, okay? So, no pain? Okay. So I can then feel for her traps and her latissimus dorsi muscles. And I'm noting for any atrophy there as well, and pain. So I'll palpate. They feel symmetrical. Let me know if you feel any pain.
Okay.
And there's no pain. Okay. So we can move on to the range of motion of her neck. Okay. So I'll stand in front of the patient and I'll have her mimic what I do. So we'll begin with just flexing the neck down, just go like this, okay, and go all the way up. And turn your head to the side and the opposite side. And look all the way over your left shoulder and your right shoulder. Okay, so I was able to note all planes of motion with the patient. She was able to flex, she was able to extend, she was able to laterally bend on both sides, and she was able to rotate on both sides as well. Any pain with that? Okay. So now I can perform, that was active motion of her moving that muscle, and I can perform passive motion of the muscle now too, okay? So I'm just going to hold her head, and I'm going to perform those motions as well. So just relax your head for me. So we'll go back, we'll go down, we'll go to the side, the opposite side, and then I'll rotate, and we'll rotate. Any pain?
No.
Okay, and I was able to do that with ease. So I'll now move on to the upper extremities. So going to have the patient stand for this part, and we'll check the shoulder range of motion, okay? So again, we'll begin with active, then move to passive, and then move to against resistance. So I'm going to have the patient flex her shoulders, so she'll do that just by raising them all the way up as far as she can go, all right? And then all the way back as far as she can go into extension. And then we'll go up to the top from our sides, and this is a abduction, and come across for me in the front, cross your arms, a deduction, okay? Now we'll also have the patient internally and externally rotate her shoulders, so I'm going to have you place your arms behind your head, and then place them forward and behind your back, all right? And I could note at this point what vertebra she's able to go up to, so that's about T8 or 9, I'd say that she's able to go up to. All right, so that was active. I'll now do passive motion of each. So I'll begin with the left arm, all the way back, all the way back, okay? We'll do a abduction, all the way up, a deduction, all the way across, external rotation, and internal rotation. Okay, so full range of motion in her left arm. And now we'll do that in the right arm. So full flexion, full extension, okay, full abduction. And I'm just supporting at her elbow so that her arm doesn't fall onto her head because she is in passive movement right now. And then a deduction across her body. I'll go external rotation behind her head and internal rotation behind her back. Okay. We'll now perform those motions against resistance. So going to have you try and lift your arms up against the pressure of my hands here. So try and go like this, okay? So lift. All right. And I'm going to put my hand on her tricep to test that so that she's not using her bicep, she's focusing on her shoulder to lift. So let's try that one more time. Lift it up. There you go. Okay. And try and push back. Okay. And push out. All right. And push in. Okay. I'm going to do the opposite side as well. So stabilizing her back. Push out for me. Okay. Push in. Push up. Push back. Okay. And then to check for internal and external rotation, I'll stand in front of her as if we were to arm wrestle. So I'm going to push out, and I want you to resist me and push in, okay? So go ahead. All right. And the opposite. So I'm going to push in. I want you to resist. Okay. We'll do it with this hand as well. So I'll push out, resist me going that way, and now resist me going in. Okay. So she has a grade 5 of muscle strength in her shoulder, and I can move on to the elbows now. So I'll have her do full elbow extension and then full elbow flexion, and we can add pronation and supination into the elbow movement as well, which also uses the wrist, but we'll test it here. So we'll do active, just go down and then go up. So I can note in her active extension rather, she hyperextends a little bit, so I'll make note that she goes a few degrees past what's normal of 180, okay? So I can now do passive flexion and extension. So flexion, she goes all the way up. Extension, I expect her to be able to hyperextend a little bit. I'll do the same thing on this side. Full flexion, and a little bit of hyperextension there. So I'll now test against resistance. So I'm going to have you place your arms like this. I want you to try and lift them up, okay? So she's able to resist and push down for me, okay. And she's able to resist me pulling them up by pushing down. So I was able to check her triceps muscle there. And I can note that her muscle tone is a grade 5 as well for her, for the elbow range of motion. Okay. Now I'll do the pronation and supination. So I'm just going to have her stand as she is. Put your arms out for me, and I want you to turn them over and turn them back over. So she's able to go into supination, and then when she turns in, she goes into pronation. So I'll do that passively for her now, okay? Okay. And she's able to turn. And so now I'll check against the range of motion. So I want you to try and turn your hand in against me, okay? All right, she's not able to. And try and turn your hand out, okay. And same thing, try and turn your hand in, okay? And try and turn your hand out. So that has a grade of 5 as well, okay? I can move on to her wrist now. So we'll do ulnar deviation, radial deviation, flexion, and extension of the wrist as well, okay? So first I'll just have you flex your wrists down for me, extend your wrists up, deviate them out, and deviate them in. I'm just gonna make note here for her to keep her elbows in so that we're not using that shoulder muscle. So try and deviate your hands in now for me. There you go. So now I'll do those in passive motion. So I'll flex, I'll extend, I'll radially deviate, ulnar deviation, same on this end, extension, flexion, ulnar deviation, radial deviation, okay? Now we'll do that against resistance. I'm going to hold her forearm here, and I want you to resist me pushing you down, okay? All right, and now I want you to push down on me and resist, okay. So I can now check for those reflection and extension against resistance. So now try and push your hand in, okay? And now try and push your hand out, okay? We'll do the same on this arm. So try and push your hand up, checking for extension, and push your hand down, checking for flexion, push your hand out, and push your hand in, okay. So I can assign a grade 5 to her wrist as well. We'll now move on to the fingers, and that'll conclude our upper extremity portion. So I'm going to have you curl your fingers in, and then extend your fingers out, flare them out for me like so, okay? And bring them in. I'm going to have you cross your thumbs over to your pinky. So we're checking for thumb opposition there, okay? Just the bottom here, yeah, there you go, all right. And I can now check for passive movement of all of that. So I'll take her hand, and I'm going to curl it in. I'm able to do so, curl it out. I'm able to move her fingers out. I'm able to pull them back in. Able to curl their fingers in, curl them out, abduct them, adduct them, okay? I'm now going to perform this against restriction, so curl your fingers in for me, and don't let me pull them out, okay? So
Hey guys.
I'm now going to perform that against extension. So try and extend your fingers. Try and curl your fingers in for me. Okay. And try and fan your fingers out into abduction. And I'm gonna go in between your fingers and squeeze closed for adduction. Okay. Make an okay symbol for me, and try and resist me pulling out, okay? So she's able to resist, all right? I'm not able to separate her fingers. So that is those are the fingers, okay? So now I can do her grip strength. So I'm going to make sure that I cross my fingers over themselves just to prevent injury of my own fingers. And I want you to squeeze my fingers as hard as you can in your hand. Yeah, there you go. Squeeze, squeeze, squeeze. Okay, so her grip strength is there. Okay, I can assign her grip strength of 3+. And now I can have her take a seat. So I'll continue the musculoskeletal exam by testing the lower extremities. So we'll start with the hips. So I'm going to have the patient just with a straight knee, raise her leg all the way up, her right leg, and lay it down. And the same with the left, raise all the way up and lay it down. Okay, I'm also going to have you cross your right leg over your left leg. So this is a deduction of the right leg and bring it all the way out with a straight knee. And this is a abduction of the right leg. So now with the left leg, I'm going to have her cross it over the right, a deduction of the left leg, bring it out with the straight leg, and that's a abduction of the left leg. Okay? Now I'll have her do internal and external rotation of the hip. So bend your right knee for me, and just let your leg fall out to the side. There you go. So that's external rotation, let it fall in, internal rotation, and now you can straighten that leg for me. Bend your left leg, and just let it fall out to the left, external rotation, and fall into the right, internal rotation. So that was active motion, and now I'll do passive. So I'll lift her leg all the way up, okay? Going to abduct it, going to adduct it, and I'm going to externally rotate it and internally rotate it. You okay? I'm going to do the same on her left. I'm going to lift her leg all the way up. Okay. Going to abduct it, adduct it, going to externally rotate it, and internally rotate it. And lay it back down. And now we'll perform those motions against resistance. So I'm going to place my hand on her thigh so that I'm locating the hip muscle, making sure I'm not using any of the lower extremities. So try and lift against my hand, okay, and relax. Lift against my hand, and relax. Push your left leg out against my hand, okay. Push your left leg in. Push your right leg out, and push your left leg in, or your right, rather. Now I'm going to bend your hip, and I want you to try and internally rotate it in against my hand, okay? And externally rotate out against my hand, and relax. And the same with the left leg. Try and push out, and try and rotate it in, okay? So I can assign a grade 5 to her hip muscles, okay? And we'll do extension later on in the video when she turns over, okay? So now I'll move down to the knees. I'm going to have you bend your right knee for me, extend your right knee for me, and bend your left knee for me, and extend your left knee for me, okay? And then I'm going to just place my hands underneath her knees so I can feel the extension. So extend down for me, okay, and relax. And now I'll do passive motion of those. So I can bend, okay. And now we'll do against resistance. So I'm going to bend your leg a little bit, and I want you to push down on my hand on your calf here. So go ahead, all right. And now I want you to kick up, okay. So she was able to resist both flexion and extension there, and I can do the same on the left leg. I want you to bend down for me and kick up, and I can assign a grade 5 to her knee muscles as well, okay? So I can move down to her ankles, all right? So I'm going to have her go into dorsiflexion, which is pointing her feet up towards the sky, and then plantar flexion, which would be pulling them down towards the ground. So pull your feet all the way up to the sky for me and point them all the way down, okay? Push them out like a penguin and pull them in, okay. So I can perform that in passive motion. So lifting her foot up into dorsiflexion, down into plantar flexion, up into dorsiflexion, down into plantar flexion. I can deviate it in, I can deviate it out, again, deviate it in, and deviate it out, okay? And I can move on to testing against resistance now. So I want you to push up against my hands, and down against my hands, and push out against my hands, and push in against my hands. Okay. Now I can move on to her toes. So I'm gonna have you curl your toes and fan your toes out all the way. Okay? And then I can do that passively. All right, and then curl your toes for me, and don't let me curl them all the way, and don't let me pull them apart, okay? So this would be against resistance, okay? And now I'm going to ask her to I'm gonna hold on to her big toe and ask her to close her eyes, and then I'm going to check if she can sense proprioception to see where her toe is. So I'll move it up and down, and I'll ask her what direction it's going into, so.
Up, down, down,
Yes. And then on the left foot.
up, down.
Okay, so she's able to tell which direction her toe's going into. So now I can have her turn onto her left side. I'll try to, it's really small.
Okay.
Okay, so I can check for hip extension in this position. All right, so I'm gonna have you push your right leg back. I'm gonna go all the way onto your, yeah, there you go. All the way onto the side. And now push your right leg back. Okay, and bring it back into neutral position. So then I can extend her leg as well, all the way back. And now I'm gonna place my hand on the back of your thigh and press against it. Okay. And I'm gonna have you turn to the other side. Take your time. Okay, I'll just place my hand on her back so she doesn't fall off. Extend your hip back for me and into neutral. And now I'll do passive motion for her, extending it back into neutral. Press against my hand, and that's against resistance. You can lay flat. So I can say that her extension has a grade 5 as well. I'll now check for the lumbar spine, so I'm gonna have you sit back up. You could stand up for me. I'm just gonna have you flex all the way down as far as you can and extend all the way up. Okay, then I'm going to have you lean to the right, check for lateral bending, and lean to the left for lateral bending, and then bring it around town, as we say. All right, so I can see that she's able to do that in active range of motion. And that concludes our musculoskeletal exam for today.